Hello all, welcome to another video of EM Simplified. So today what I would like to discuss, you know that many of you will be using instead of phenytoin, levitracetam in your emergency department or in your ICU or in the ward scenarios. Whenever you see a patient with seizure or you wanted to prevent a seizure as a prophylactic measure, levitracetam has been using very frequently in our emergency room. So many a times, the standard dose that we say for an adult patient, maybe 1 gram you will be giving stat, that is reasonable to prevent an seizure episode. Or you are going to give it for a patient with a suspected head injury and you don't want him to go to have a seizure, that is a good dose. But you have to definitely understand what is the recommended dose of levetiracetam for a patient that is having status epilepticus. So as by definition, you know what is status epilepticus: more than 5 minutes the seizure have not resolved, or in between two seizure episodes the patient have not gained consciousness. You are using your first line drugs like benzodiazepine, and you decided to go ahead and give the second line drug, either phenytoin, phosphenitoin, or levetiracetam. So many of the centers, they go for levetiracetam right now. So whenever you are using levetiracetam for a treatment of status epilepticus, I am very specific here. What I am saying is the treatment of status epilepticus, the dosage have to be 40 to 60 milligram per kilogram body weight. So that is the recommended dose that you need to keep in your mind. So you need to give approximately 1 to 3 gram of levetiracetam depending upon the patient's body weight. You can give it as an infusion or maybe over 10 minutes to 15 minutes. So that is the recommended dose for your status epilepticus. So whenever you're treating for status epilepticus, you need to increase your dose of levetiracetam. Maximum recommended is 4.5 grams. So you need to keep that in your mind, and when you treat especially pediatric seizures or adult seizures, status epilepticus, to be very specific. I'm not saying for the prophylaxis one that you are going to give, or maybe the patient have missed a dose of levetiracetam and is coming with a seizure to the ED. So that is not the dose what I am saying. I'm very specific. Whenever your first line agent have failed, you have decided to give a second line agent for your status epilepticus. The dose of levetiracetam what you need to give is 40 to 60 milligram per kilogram body weight is what you need to give. 4.5 grams is the maximum recommended dose. So just keep in your mind whenever you are going to give levetiracetam next time in your emergency department for status epilepticus. Thank you.